The United States has long been seen as the standard bearer of public health policy, but now its new health secretary, Robert F. Kennedy Jr., has publicly questioned the value of vaccines. At a time when we're seeing cases of measles go up 20% worldwide, that is cause for concern. Dr. Donald Vinh is an infectious disease specialist at the MUHC. Hi, Don.
Hi, Mitsumi.
So, Robert Kennedy Jr. has fired all the members of the U.S. Advisory Committee. He's replaced them with his own people. They're recommending that no one use vaccines that contain thimerosal. Now, what is this thimerosal?
Yeah, so what we're talking about here is mercury, but there are two different types that are being conflated. There's methyl mercury. This is the organic form of mercury that can be found in the environment and that can accumulate in fish and shellfish. Then there's ethyl mercury, and this is thimerosal, a different form of mercury that's used in trace amounts in some vaccines as a preservative. In fact, it's been used since the 1930s to prevent bacterial contamination. Thimerosal is eliminated from the body much more quickly than methyl mercury, so it is much less likely to accumulate. And numerous epidemiological studies from several countries over the last 2 decades have found no evidence that the thimerosal containing vaccines cause any neurodevelopmental or psychological conditions. If anything, studies have provided strong evidence against thimerosal causing these effects. But despite no signals of concerns, manufacturers have actually been removing thimerosal from vaccines since 1999, as requested by U.S. agencies then. And currently, thimerosal is no longer present in routine childhood vaccines in Canada, except for some influenza vaccines that are made in multi-dose vials.
Now, they're also questioning the value of childhood vaccines, measles, chickenpox, hepatitis. But there's always the fear, isn't there, that these policies will make people question all vaccines?
Yeah, for sure. I mean, RFK Jr. is using thimerosal as a cover to push a deeply anti-vaccine, anti-science agenda. What started as fringe rhetoric now has an executive platform where he can impose these views onto others. And the fear is that people have begun to question the very life-saving nature of vaccines, not because of new evidence, but because of misinformation and lies dressed up as concerns. This breeds unfounded doubt, lowers vaccine uptake, and it sparks outbreaks of preventable diseases, as we've already seen, as you said, with measles and also with whooping cough. But the repercussions are actually global, because in many parts of the world, vaccines are the only thing standing between children and death. And this anti-science agenda will actually prevent people in developing countries from getting vaccines, which will likely cause mass preventable deaths, collapse healthcare systems, and economic destabilization. So this isn't just a public health setback. It's the tipping point towards a humanitarian crisis.
But supposing, Don, should a new health secretary come in a few years' time, say this was all a mistake, they start vaccinating children again, is this something that can be quickly reversed?
Unfortunately, it isn't as simple as flipping a switch. Decades of global health policy, from the WHO's expanded program on immunization to Gavi and national programs, have shown that building and sustaining vaccine coverage requires evidence-based strategies, trust, strong infrastructure, and consistent delivery. Once any of these pillars is undermined, it can take years, but more likely decades to rebuild. And in the meanwhile, outbreaks of preventable disease will surge, hitting marginalized and rural communities hardest due to limited access to care. And so, yes, to your question, a new health secretary could reinstate vaccination programs, but regaining lost ground would be slow, costly, and unfortunately, lives will be lost in the process. So stopping and restarting isn't just inefficient, it's dangerous.
So what might all this mean for us here in Canada? You know, I've heard some people say, what if Americans come to Canada for vaccinations and create shortages here? Is that kind of thing possible? And what can we as individuals do about any of this?
I mean, it's a possibility. If the U.S. rolls back routine vaccinations, some Americans who want to live may look to Canada for access to those vaccines, and this could potentially strain our vaccine supply, especially for products that may already be limited in global availability. That said, Canada has strong federal and provincial programs in place with systems designed to prioritize Canadians and try to maintain a supply continuity. But to your other point, as individuals, the most important thing we can do here is stay informed and trust evidence based guidance. Keep your vaccinations up to date. Speak to your healthcare provider if you have concerns. Help counter this misinformation when we see it, especially online, because vaccine confidence is something we build together. And in moments like this, community action and informed advocacy really do matter.
Okay. Thank you very much for this, Don.
Yeah, thank you, Mitsumi.